Welcome back to the only place that's going to help you become a PM&R superstar. Once again, my name is Dr. Bruno, Subbarao, the People's Physiatrist, in your AOCPMR Fellowship Chair. Now let's take a look at case number 21. Case number 21, a 55-year-old male presents to your clinic complaining of increasing fatigue, especially noted after activity. If your suspicion for Lambert-Eaton Syndrome is correct, what would you expect to find on your high-rate repetitive stimulation test? A, an amplitude increase of 2 to 300%, B, a decrement demonstrated and partially repaired, C, a mild increment, or D, no change at all. So what is high-rate repetitive stimulation, and will it cause change, or is it just campaigning for 2016? Well, let's take a look at the normal physiology of a neuromuscular junction. When an action potential propagates down to this presynaptic neuron terminal, these voltage-gated calcium channels will open up. With the influx of calcium, these vesicles will want to migrate down towards the synaptic cleft to release their acetylcholine molecules. Now this is done by way of these snare family of proteins. With acetylcholine molecules in the synaptic cleft, they'll be available to attach post-synaptically to these nicotinic acetylcholine receptors at the motor end plate, thus propagating the action potential, depolarizing the motor unit, and generating a motor unit action potential. And the more attaching of molecule to receptor, the more motor units depolarize, and the larger the amplitude of the motor unit action potential. So let's take a look at some neuromuscular junction disorders where some of this can go wrong along this pathway. The three I'd like to talk about today are Lambert-Eaton Syndrome, Myasthenia gravis, and Clostridium botulinum toxin, each uniquely affecting the neuromuscular junction. Beginning with Myasthenia gravis, you can see that it's an autoimmune disease against the postsynaptic acetylcholine receptors. Next is Clostridium botulinum toxin, which specifically targets the presynaptic snare family of proteins, which, as you remember, are the ones that help the vesicles fuse and dock to release their acetylcholine molecules into the synaptic cleft. And lastly, Lambert-Eaton syndrome is an autoimmune disease against the presynaptic calcium channels, thus not allowing sufficient calcium influx. So in a Lambert-Eaton myasthenic syndrome patient undergoing high-rate repetitive stimulation, you're going to cause a rapid generation of action potentials. So although there's few voltage-gated calcium channels remaining, they're going to be forced to remain open and push in whatever calcium they have to release these acetylcholine molecules. So although it's going to start slow, the influx of calcium will increase, thus the release of acetylcholine will increase, thus increasing the amplitude of your motor unit action potential up to 200 to 300%, and that is your answer. Taking a look back now at the question, we can see that the answer is A, an amplitude increase of 200 to 300%. However, B and C correlate as well to myasthenia gravis and botulinum toxin respectively. So with Clostridium botulinum toxin, you may see a mild increment in the amplitudes just due to the sheer amount of calcium influx into the presynaptic neuron terminal. But with myasthenia gravis, there's only a few remaining postsynaptic nicotinic acetylcholine receptors. Thus, you're going to initially see a decrement in amplitude. However, as more acetylcholine gets pushed out and left in that synaptic cleft, you have a better chance of it attaching to all the remaining nicotinic acetylcholine receptors. Thus, you can partially repair that decrement. So just to finish up with some key points, in Lambert-Eaton syndrome, exercise will improve the fatigue. It affects males greater than female. You can remember this because Lambert sounds like a man's name, like the singer Adam Lambert. This affects presynaptic voltage-gated calcium channels. Remember, Lambert-Eaton for presynaptic. Think about small cell or oat cell carcinoma. The treatment will be to treat the malignancy. You can remember this by Lambert is eating his small oats. In myasthenia gravis, remember that exercise will exacerbate the fatigue. This affects females more than males. To remember this, remember that Maya sounds like a female's name. Lastly, be aware that there's an association between a thymus tumor and myasthenia gravis. Therefore, one treatment option is thymectomy. The Tensilon Test uses Edrophonium, which is just an anticholinesterase drug. And what is the treatment for myasthenia gravis? Anticholinesterase drugs, which all they do is allow more time for these acetylcholine molecules to remain in the synaptic cleft for the best possible chances to attach to the remaining post-synaptic receptors. And finally, with botulinum toxin, remember it's going to cause widespread paralysis, and this will happen 2 to 7 days after the ingestion of raw meats, fish, or classically honey. The treatment of choice is trivalent ABE antitoxin. Botulinum? I hardly knew him. That's it for us this week. Join me again next time at www.aocpmr.org. Subscribe to these videos and like us on our Facebook page. Till next time, everybody.